This is the pre-op model of the patient. Step 1 is to put this resection guide at this location. Fix this guide with 2 mm diameter screws. Any two holes can be used to fix this. Then cut it from here. Step number 2 is place this resection guide at this location. Then cut it from here. When that is done, go to the fibula bone. This is right side fibula bone. This is titanium cutting guide. This will be placed 8 centimeters away at the right side fibula bone, and this will be placed like this, in this fashion. When you place this, do the first slot here, second here, third here, and fourth here. First will be of use, second will not be used, and the third one will be used. Take out these two bones, and when the mandible is resected, this one is the preserved mandible. So you can see that here also it is sitting like this guide. So you will be cutting from here, and second you will be cutting from this bone like this. So this will be the first piece of the bone that you'll get, and this one will be the second piece. When you get that, this will be the reconstruction plate, mirror finish from outside and matte from inside. This will be placed completely like this. Exactly, it will be fitting like this. 2 mm screws will be used to fix at 3 over here. Then here 1, 2, 3, 4, and we have provided some bear hugs 1, 2, 3, 4, 5, 6, 7, 8, which will be used to fix this fibula.